Hello everyone. This afternoon we will talk about pregnancy. So the first question is, what is pregnancy? Pregnancy is the period after the egg is fertilized by a sperm and then implanted in the lining of the uterus. It develops into the placenta and embryo. It lasts about 38 to 40 weeks, counting from the first day of the last normal period. It has three phases or stages. First, second, and the third trimesters. Each trimester lasts between 12 and 14 weeks. So what are the signs of pregnancy? Pregnancy commences at the time the male sperm penetrates an egg and fertilizes it. The course of pregnancy usually lasts about 40 weeks from the start of the last normal menstrual period, or about 280 days from the last normal menstruation period, and the period of gestation is calculated at around 38 to 42 weeks. And the signs and symptoms of pregnancy vary according to the stages of pregnancy called trimesters. A trimesters is determined by dividing the 40 weeks into 3 months long. These trimesters are referred to as the first, second, and third trimesters, which characterize the different events that trigger the signs and symptoms experienced by the pregnant woman. So what are the factors that put a pregnancy at risk? Yes, we have existing health conditions. First, high blood pressure. Even though high blood pressure can be risky for mother and fetus, many women with high blood pressure have healthy pregnancies and healthy children. Uncontrolled high blood pressure, however, can lead to damage to the mother's kidneys and increases the risk for low birth weight or preeclampsia. Polycystic ovary syndrome is a disorder that interferes with a woman's ability to get and stay pregnant, or may result in higher rates of miscarriage, gestational diabetes, preeclampsia, and premature delivery. Next factor is diabetes. It is important for women with diabetes to manage their blood sugar levels before getting pregnant. High blood sugar levels can cause birth defects during the few weeks of pregnancy, often before women even know they are pregnant. And controlling blood sugar levels and taking a multivitamin with 400 micrograms of folic acid every day can help reduce this risk. Next is kidney disease. Women with kidney disease often have difficulty getting pregnant, and any pregnancy is at significant risk for miscarriage. Pregnant women with kidney disease require additional treatments, changes in diet and medications, and frequent visits to their health care provider. Next is autoimmune disease. Autoimmune diseases include conditions such as lupus, and some autoimmune disease can increase a woman's risk for problems during pregnancy. For example, lupus can increase the risk for preterm birth and stillbirth. Some women may find that their symptoms improving during pregnancy, while others experience flare-ups and other challenges. Certain medications that treat autoimmune diseases may be harmful to the fetus as well. Next is thyroid disease. Uncontrolled thyroid disease, such as an overactive or underactive thyroid, can cause problems for the fetus, such as heart failure, poor weight gain, and birth defects. Next is infertility. Several studies have found women who take drugs that increase the chances of pregnancy are significantly more likely to have pregnancy complications than those who get pregnant without assistance. These complications often involve the placenta and vaginal bleeding. Next is obesity. Obesity can make a pregnancy more difficult, increasing a woman's chance of developing diabetes during pregnancy, which can contribute to difficult births. On the other hand, some women weigh too little for their own health and the health of their growing fetus. In 2009, the Institute of Medicine updated its recommendation on how much weight to gain during pregnancy. New recommendation issued by the American College of Obstetricians and Gynecologists suggest that overweight and obese women may be able to gain even less than what is recommended and still have a healthy infant. So what are the risk factors? Number one is smoking cigarettes, drinking alcohol or using illicit drugs, poor nutrition, multiple miscarriages or abortions, physical injury or trauma, or chronic conditions. Other is stressful life events, example, death of loved ones, or domestic violence. And also have other infections, pregnancy with twins, triplets, or other multiples, or an interval of less than 6 months between pregnancies. Also the age. Teen pregnancy, pregnant teens are more likely to develop high blood pressure and anemia and go into labor earlier than women who are older. Teens may also be exposed to sexually transmitted disease or infection that could affect their pregnancy. Teens may be less likely to get prenatal care or to make ongoing appointments with healthcare providers during the pregnancy to evaluate risks, ensure they are staying healthy, and understand what medications and drugs they can use. First-time pregnancy after age 35. Older first-time mothers may have normal pregnancies, but research indicates that these women are at increased risk of having cesarean, delivery complications, including excessive bleeding during labor. So is there any lifestyle factors? The answer is yes. First is alcohol use. Alcohol consumed during pregnancy passes directly to the fetus through the umbilical cord. The Centers for Disease Control and Prevention recommend that women avoid alcoholic beverages during pregnancy or when they are trying to get pregnant. During pregnancy, women who drink are more likely to have miscarriage or stillbirth. Other risks to the fetus include a higher chance of having birth defects and fetal alcohol spectrum disorder. So it causes abnormal facial features, short stature, and low body weight, hyperactivity disorder, intellectual disabilities, and vision or hearing problems. Next is cigarette smoking. Smoking during pregnancy puts the fetus at risk for preterm birth, certain birth defects, and sudden infant death syndrome. Secondhand smoke also puts a woman and her developing fetus at increased risk for health problems. So, risk of miscarriage and maternal age. Some studies have shown a higher chance of miscarriage in older mothers when considering all women. About half of first trimester Miscarriages happen because of a chromosomal abnormality in the fetus. Because these abnormalities increase with maternal age, miscarriage is also more likely. A new test is available that looks at cell-free fetal DNA in the mother's circulation to check for chromosomal abnormalities. At age 35 is considered advanced maternal age, but risk increase as a woman ages. So if you are pregnant and over the age of 30, talk with your health care provider about your individual health. Discuss plans for helping you and your developing baby maintain a healthy pregnancy. Thank you and more power.
Ilang pwede ito na ito na.